nursing is probably the scariest thing I have ever done in my life. And I came to it late in life because of my oldest son, who had 3 tours in Iraq. He served with the United States Marine Corps. And when he came back, the care that he was receiving was just completely inadequate for what he needed to have happen. He had a 60% disability related to different medical conditions, but the worst things by far were the invisible wounds, TBI, traumatic brain injury, and PTSD. There's no black and white, correct, one-size-fits-all treatment for those things. It's very much individually tailored, and therein lies the difficulty in finding good care. I knew that something was wrong, he was not being treated correctly, because suddenly Sean went from being this happy-go-lucky, passionate guy to this dark, violent, at times scary person who would have these sudden outbursts. One advantage that I had is that my children all know that no matter what, they can talk to me. And so Sean would often say to me, "Mom, let's go for a ride." And I knew for 2 or 3 hours I would be captive in his car, and I would listen to all this stuff that he had no place to put. And I said, "Well, aren't they addressing this at the VA? Aren't you seeing a therapist?" And no, they're just giving me pills. And so I thought, all right, well, let's get out a drug guide and let's look at your MAR, your medical, administration record, and see what you're being given and what was the rationale for that. And it turns out here he was, 28 years old, being prescribed on a routine basis almost 30 different medications. A lot of psychoactive drugs, some cardiac drugs, because these psych drugs affect heart rate, they affect all kinds of things, and that fosters its own type of polypharmacy. I obviously have a mission here, and I obviously need to get in there and study this and try to figure out how I can change or lead a change in how we care for psych patients, because this is not addressing his needs. It's not treating what's wrong. It's not helping him to live a good life. I was interested in a very high quality, very high academic standard, because I knew I wanted to go on from my BSN. I just love the online context, because I had a full-time nursing job. I was working, 5/8 a week, plus my BSN program, and I didn't drop the ball in either venue. I graduated with honors. Frankly, as a DNP, I can not only work as a provider, I can work more as a theorist and look at how our practice is conducted and how I can develop practice theory that would be applied directly to clinical situations. And that's what really excites me, because that's where you can make a real change in the world of care, is right there. Not writing prescriptions, but by changing practice theory. And I believe with the education I'm getting here, I will be able to do that.